Genetic factors, various environmental toxins, radiation, and cigarette smoking have all been linked to cancer of the brain. But in most cases, no clear cause can be shown. We learn about the symptoms and the latest tools to treat brain cancer from Dr. Steve Damore of Orange County CyberKnife.
There are two general types of brain cancers. There are primary brain cancers, which are cancers that start within the brain itself. And then there are secondary brain cancers, which means they are malignancies that have spread from somewhere outside the brain into the brain. Both of which offer unique challenges in terms of treatment, and both of which are treated with various types of radiation, including the CyberKnife.
We asked Dr. Damore what are the symptoms of brain cancer and how is it diagnosed?
Patients with cancers in the brain present with a variety of symptoms. Some of the symptoms are related to increased pressure, and those include headaches, nausea and vomiting, or visual changes. And then other symptoms are related to the actual location of the tumor within the brain, and some of those can include seizures, loss of sensitivity in one part of their body, loss of motor function in one part of their body, cognitive impairment, meaning difficulty with remembering or speaking or doing higher ordering thinking processes. Most patients with brain cancers are seen by a physician because of some symptomatology caused by the brain cancer, and that often leads to imaging studies, usually a CAT scan or a CT scan of the head, or more commonly now an MRI scan of the brain. For patients who are diagnosed with cancers in the brain, the options consist of surgery or radiation therapy or chemotherapy or a combination of any of these, and it really depends on the type of the cancer and the location and the size of it that determines which of these options would be selected for the patient.
What are the treatment options for brain cancer?
One of the options is CyberKnife stereotactic radiosurgery, which is playing an increasing role in the treatment of brain cancers. The CyberKnife system includes many of the conventional radiation therapy hardware in terms of a couch that the patient lays on and a linear accelerator which generates the radiation beam. It has the ability to detect subtle movements of the tumor inside the body, which often can play a role in the treatments of malignancies in other parts of the body. In the brain, the tumor is a stationary object, and we don't have to compensate for movement. But with the CyberKnife, we're able to deliver large treatments in terms of the radiation dose, large radiation doses at a time, because we can do it as precisely as we can, and that allows us to give fewer treatments. And so a conventional course of therapy for a patient would often be 6 weeks or longer, whereas with the CyberKnife we usually do it in less than a week, and oftentimes in a single treatment. In terms of treating diseases of the brain, it is doing very, very well. For example, when we look at patients with metastatic tumors to the brain, meaning cancers that spread from elsewhere in the body into the brain, the local control rates, or the rate of controlling the tumor, is in the neighborhood of 90%, which is a terrific statistic for patients with that condition.